It's a real pleasure this morning to introduce Dr. Bryan Sibley. He's a friend and colleague for many years now. Bryan is native of Crowley, Louisiana.
Who said that? All right.
My parents are from Gale.
I like that.
And Dr. Sibley actually sat in what used to be the seats where you're sitting because he attended medical school here and did pediatric training at the University of Texas in Houston. And he's been in private practice in Lafayette for a little over 20 years now. And Bryan is currently the president of the Louisiana Chapter of the American Academy of Pediatrics. And today he's going to talk to us about physician well-being in the 21st century. And this is an important topic because there is a lot of recognition that the stress on physicians is still fairly high. We're not as stressed as dentists are, but we're still pretty stressed. And even just to that point, a couple of days ago there was an article about stress in medical school and the number of medical students who actually commit suicide is much higher than the general population. So physician well-being is not just a beginning of the career or end of the career kind of topic. It's throughout the career and has to be re-emphasized every time. So Dr. Sibley will take us on a journey.
Thank you. Can you hear me okay? Great, thank you. Well, I appreciate you being here. Thanks, John, for that nice introduction. Yeah, it's been almost 30 years since I've been on this campus. Well, I guess I came back once right after I graduated. But well, yeah, after that, though, one more time. I was on a recruiting trip trying to get people to come to do residencies in Houston. Dr. Bocchini was not happy about that. They've made it a lot nicer. Although I was pointing out to John, I noticed you still have slide projectors in the back. I guess they haven't thought to take those out. I suspect you don't use them nearly as much as we did. So today's talk is what John said. I've got it divided up into three parts. The first part's a commercial, really. It's a commercial about being a member and participating in the Louisiana Chapter of the American Academy of Pediatrics. The second is really the meat of the talk, and the third is a little bit of a commercial about some of my own story and how it relates to well-being. So, I did write a book, disclosure, I wrote a book. It was published about a month ago. I haven't received any real royalties off of it yet. I am supposed to tell you if I'm going to make money off of it. I don't plan on retiring off of this book, but it is available and we will talk about it just a bit at the end of the talk. The objectives today, we want you to get an understanding of what physician well-being actually means, how it is, or what burnout is and how you can deal with burnout in your own lives and your own careers. Become familiar with methods of coping with stress, maximizing your well-being, and enhancing your overall quality of life as a physician in a career in medicine. And that you understand what happens when you achieve a positive state of well-being. So first, a commercial. The Louisiana Chapter of the American Academy of Pediatrics is the Louisiana liaison between the American Academy of Pediatrics and the members in Louisiana. This is our executive committee, and you can see that we represent all parts of the state: Shreveport and Baton Rouge, Mandeville, Lake Charles. Ashley Politz is our executive director, and Allison Hagan is her assistant. They're here today. Ashley and Allison are sitting in the front. If you have any questions about the chapter or want more information, they'd be happy to help you with that today. By the way, these are all non-paid positions. We all serve voluntarily, as have our predecessors for a number of years. And we work diligently. We were having a conversation this morning and several yesterday on behalf of our members. Hopefully most of you are part of that group. So we work to implement AAP policy both at the state and local levels. The Academy has gotten much better about letting us know about policy changes that affect us than they used to. And that was because of an outcry from members and chapter leaders throughout the country. There were policies that came down from the Academy that affected the way we practice, but could be in opposition to some of the ways that some of us practice in our communities. And so we have much more opportunity to impact those policies prior to their becoming public, and we certainly appreciate that opportunity from the Academy. Members come to us and tell us they have needs. Everything from what is the Academy doing with MOC and for board certification, to what are you doing to help us get better reimbursement for the work that we do in our practices, and everything in between. And there are a lot of issues that happen locally that we manage. We are probably, as much as anybody, in contact with both our elected officials down in the legislature in Baton Rouge, as well as the Louisiana Department of Health, almost, certainly weekly and almost daily in some times of the year, to affect change, especially as it relates to our practices and, more importantly, the children we take care of. Why join? Well, as we said, we provide a lot of advocacy. We do a lot of advocacy work. Every spring, we invite residents, pediatric residents from the programs here in Louisiana, down to Baton Rouge to work with Ashley and our lobbyists. I'll talk about that in a second, to actually lobby legislators. It's been a very rewarding experience, I think, both for the residents and for the legislators. They're always excited, the elected officials are excited, to meet young physicians who are interested in changing the world to make it a better place, especially for our children. The American Academy of Pediatrics is probably the only professional organization that truly exists for its patients. A lot of leadership opportunities. You can serve. If you are interested in serving in our chapter, we would love to have you. We have a resident section. Over the years, we've had very active residents, some more than others, and many of whom have continued to be leaders in our chapter as they've finished their residency and go into practice. And we have a lot of educational opportunities. We're working on an online CME portal. We have an annual meeting. This year it was in Shreveport in August, and next year it'll be in Lafayette. As part of that annual meeting, we invite each of the residency programs to submit one resident who does a poster presentation and does a presentation to the meeting attendees on Saturday morning. It's been very rewarding, and it's also for us because we get to meet the residents, and it's been nice to see all the work that you all are doing as part of your residency programs. We've engaged a full-time lobbyist on our behalf. Over the years, our chapter has had different lobbyists. Oftentimes, they've been sort of part-time. That is, they would work just during the legislative session. Well, this year, we've jumped off the cliff and found a way to hire a full-time lobbyist. This is Greg and Eddie. We had an issue that popped up yesterday I alluded to a minute ago. They've been working with us all day yesterday and again today and probably into next week. An issue that affects everybody who sees children through the Medicaid program. And you may know that 70% of children in Louisiana are born into the Medicaid program. So it's a reality for pediatricians. And there's a potential rate or fee cut that's coming our way. And so we have been working diligently with our lobbyists as well as the Department of Health and several of the managed care organizations to make sure that doesn't happen. And they're available if you ever need anything. They'd be happy to talk to you. They probably, I think, enjoyed working with the residents down at the Capitol last year, maybe more than anybody, because it was a new thing for them. For the first time in the history of our chapter, we developed a political action committee. It's called Louisiana Pediapac, and we have a website, pediapac.org. Those of you who have a little extra money, we'd love to have it. What we found, not really the hard way, but we found out this past year we were opposing a bill that would allow nurse practitioners to have independent practice authority. That is, nurse practitioners, would be able to practice without supervision of a physician. And that law exists in other states, and we were fighting to oppose that. And when we talked to elected officials and about how they were going to vote, what we found out was cogent, educated, well-thought-out arguments by educated physicians didn't mean nearly as much as a small contribution to their campaign. And we were told that in so many words. The nurse practitioners had $1 million to spend on this deal. We had zero. They had $1 million. Now, I don't know where the nurse practitioners got $1 million from, but they They got $1 million. It meant that much to them, and this is not the first time they've had high-paid lobbyists come down to Baton Rouge to try to get this done. So we started this PediaPAC, this political action committee, and we just initiated it in August, and so we're growing it. It's something you're going to be hearing more about, I think, over the years, and it demonstrates the importance of, if we want practice autonomy, if we want to continue to be the people who drive medicine as physicians, we've got to get involved in what goes on, especially in the venues where people are deciding how it is we're going to practice. 2 items we're going to be working on this year. The first is the exemption of non-medical, the elimination of non-medical vaccine exemptions. There's only about 18 states in the country right now that still allow parents to decide on behalf of their children that they can just say, well, I'm going to take an exemption to vaccines for no reason, or for, I can claim religious reasons or whatever. In Louisiana, there's only about 400 of those children on record when they started kindergarten whose parents took a non-medical exemption to vaccines. Now you all may know, a couple of years ago, there was an outbreak of measles. It started in California at Disneyland, is where it was traced back to. And a couple of years ago, or shortly after that, California, one of the sort of the hotbed of anti-vaccinators in this country, their state legislature passed a law that removed non-medical vaccine exemptions. So we thought, well, if they can do it in California, surely we can do it in Louisiana, you know. And so we've started that process. Dr. Mancheri and I met with our lobbyists and with a gentleman who's the head of an organization that's most likely to oppose us in the upcoming legislative session. And so we're working through that process. It's, you know, there's an ongoing conversation about other folks in the state will get to support us on this, including Public Health Department and Department of Health and the State Medical Society and so forth. And by the way, we work with those folks all the time. And some of the response we've gotten has been, well, you know, it's only 400 children. And my answer to them is, Thanksgiving Day, there was a syndicated article in the newspaper that ran throughout the country about what's going on in Texas. And right next door, in Texas, the number of anti-vaccinators has increased by almost 100-fold or something. It's gone from a few thousand to tens of thousands of people throughout Texas. Well, that's right next door. And it's not just a function of, you know, well, are people in Louisiana going to start taking this non-medical exemption? It's also an issue of, well, if we have all these unvaccinated children in Texas and they're right next door, and we have all these children who are coming in from Mexico and South America into Texas, and it's right next door, what happens to our children? What happens to the public health in Louisiana? You know, so these are the types of things that we're working on as a chapter, and we would encourage your membership. The other thing is, I alluded to a minute ago, we believe that children will get the best care in the offices and the practices of those folks who are trained to take care of children. Now, those are mostly pediatricians and pediatric subspecialists. It is a reality that those physicians we have to deal with and expect payment from Medicaid for our services. It is also a reality that we have to run practices. And whether I own my own practice or you work for somebody else, somebody at the end of the day has a bottom line they've got to meet. So we're pushing, and we're going to continue to push and work hard with the Louisiana Department of Health to ensure that we're getting 100% of Medicare. So there's a Medicare fee schedule. It's right here. Right now, the Medicaid fee schedule is about 68% of that, or 72% of that. And we're trying to get it up to 100%. Because we believe by doing that, we can get more people, more good people to take care of children, and they can receive the best care they should get in those doctors' offices and practices. Okay, so enough about the commercial. We hope you all join the chapter, and we're looking forward to having your membership. I hope the rest of this presentation is going to be interactive, certainly interactive, a bit entertaining, and you might have some fun with it. So when I first moved to Lafayette, I grew up, as John said, in Crowley, Louisiana, and I schooled here and went to residency in Houston and moved back to Lafayette in 1993. I was at a CME meeting at a local restaurant, and I was sitting next to a gentleman who was a retired pediatrician. His name was Dr. Benny Frugier. Well, Dr. Benny Frugier started his practice as a family practitioner in the early 1950s in Eunice, Louisiana. And Dr. Frugier was his son, Dr. Bernie Frugier, is an allergist in Lafayette. And the Frugiers are just wonderful storytellers. So he sits down next to him, and he's always got a smile on his face, and he says, you know, Bryan, when I first started my practice in Eunice, I was in family medicine, and he said there was a gentleman, a physician who was retiring, and they had a retirement party for him at the hospital. Now this guy, he said, had started his practice in the early 1900s. So he'd been practicing for about 50 years. And at the party, they asked him, they said, what was the greatest advancement in medicine during your career? And he stood in front of a group of people like this, and he thought about it, and he said, morphine. They said, really, morphine? Why morphine? And he said, well, you know, before morphine, people suffered so much. He said, we couldn't cure them, maybe, but once we had morphine available, we could at least alleviate their pain, and they felt better. And he goes on and gets that smile back on his face, and he taps me on the shoulder, and he said, Bryan, this guy gave morphine for everything. If your toe hurt, shot of morphine. You had a sore throat, shot of morphine. A rash, shot of morphine. He said he gave more. He said back in those days, you know, you hear the phrase, pull your tonsils. You know, grandmas would come in and say, you know, does he need to get his tonsils pulled? He said what that refers to is they used to bring you in the office and when you were a kid, and if you get your tonsillectomy before hospital, they'd hold you still and give you a shot of morphine and take your tonsils out in the office and take you home. And he says, and let you go home. He says, so one day, my partner and I, he says, I was in general practice before I went back and did pediatrics. He says, my partner and I had a home delivery. Back in St. Landry Parish in those days, we still did home deliveries. And the baby was breech, and we had a hard time getting the baby out, and we were up with the mom all night. It was a Friday. Saturday morning, we finally get the baby out. Mom's doing great. The baby's doing great. 7 in the morning, we're driving. My partner taps me on the shoulder. He goes, hey, Benny, let's go get a beer. He says, you know, because back in those days in St. Landry Parish, the bars were open 24 hours a day. You could go get a beer anytime. He said, so we're driving down the road, and we look ahead on this dirt road, and there's this guy coming toward us on a horse. And he says, Benny, look at this guy on the horse. And he said, I looked up, and so we're getting closer to the horse. And the guy swaying back and forth, and the car got closer, and finally the horse bucked, and the guy fell off the horse, and he rolled in the ditch. And he said, we got to stop and go take care of the guy. So we'll go over there, and we look. The guy's mouth's full of galls, and we looked at his eyes, and we said, buddy, you okay? He says, oh, yeah, I was a Dr. So-and-so. He says, Bryan, that doctor had brought that man in on a Saturday morning, given him a shot of morphine, took his tonsils out, put him on his horse, and sent him on his way. Why is that important? It's a great story, and I don't recommend doing those things anymore, certainly, but it's a good story because I believe that physicians who preceded us probably worked longer hours, probably had less time off, probably made less money, but I suspect they experienced less burnout and a better quality of life than we do today. I'll spend a lot of the rest of my time talking to you about why that is and maybe what it is we can do to get to a point that we're not experiencing so much stress in our practices, in our lives. Medscape, the New York Times, the Wall Street Journal, the Association of Medical Colleges, the American Academy of Pediatrics, the American Medical Association have all identified physician stress and burnout as a high priority issue for physicians in the United States today. The Surgeon General just this April said suicide and burnout rate is high, and it's concerning to him because we're at a point in our country where we need more physicians, not fewer, and we need more people entering our profession, not fewer. Before we talk about stress and burnout, we need to define what is well-being, and so as I was putting this together, I Googled it, and this is the Google answer. Well-being is a good or satisfactory condition of existence characterized by health, happiness, and prosperity. So well, that's a nice answer from dictionary.com. Is there a medical answer? And the answer is, yeah, the Centers for Disease Control says well-being can be described as judging life positively and feeling good. Show of hands. How many people feel like they have a positive state of well-being? All right. I'm not going to ask the rest of you what your state of well-being is. That's good. That's actually about half or a little bit over. I've done this talk now 4 or 5 times, and that seems to be about the answer we get from all the audiences. Well, what is burnout? Emotional exhaustion, depersonalization, and a sense of low personal accomplishment. I'm not going to ask you who it is in the audience that may be burned out, but the AMC, this is one of their slides, they're very interested in this, particularly as it relates to young physicians, medical students, and people who are considering entering a career in medicine. So I was putting this together. I ran across this from Medical Economics. You'll note a lot of these articles, these quotes are from this year. It said, for many physicians, the professional rewards of status, security, and meaningful work are threatened by an avalanche of responsibility and stress characterizing today's practice environment, and further contributing to an escalating epidemic of physician stress and burnout. You know, I read that and I thought to myself, epidemic? I remember in medical school, in microbiology class, I think it was, or maybe it was pathology, they defined epidemic. I said, certainly, that can't be what this is. So, what's the definition of epidemic? Well, the CDC says it's an increase, a sudden increase in the number of cases of a disease above what is normally expected in a population. A disease. And not a disease like, an inborn metabolic error of metabolism, or inborn error of metabolism, like they ask you about on your board exams, one that's rare. No, an epidemic, that burnout and stress is an epidemic in the United States. How do you measure it? Well, there's several scales. This one's called the Maslach's Burnout Inventory. If you go through this, it asks you questions like, or you're supposed to take it, and it says, I deal effectively with the problems of my patients. I feel I treat some patients as they were impersonally. I'm emotionally drained from my work. I'm fatigued when I get up in the morning and I don't want to go on another day of work or face my job for the day. I've become more callous towards people since I took this job. I feel I'm positively influencing other people's lives through my work. Working with people all day is a strain for me. I don't care what happens to some patients. Or I feel exhilarated after working closely with my patients. So you can go through and score this, and tell you how many times a day or a week, a month it happens. And it gives you something like this when you finish. And at the bottom, you can see that it tells you, well, if you come out with a lot of red numbers, you're probably emotionally exhausted. Blue is depersonalization. And green, if you got a bunch of green numbers on here, then you have a tremendous sense of personal accomplishment. So in 2011, the blue bar graph, the blue graph bars, are, horizontal bars. Survey was done by specialty and ranks it from emergency medicine down to occupational and preventative medicine. And they asked physicians, are you burned out or not? And you can see that in general, in 2011, the numbers were about anywhere from 30% to 60%, ER medicine being at the top. Surprised urology was so high. It wouldn't have occurred to me that. PM&R was pretty high. I wouldn't have thought that either, family medicine. There's pediatric subspecialists. And by the way, the red horizontal graph is 2014. But so anyway, pediatric subspecialists are down there. General pediatricians even lower. I think that has to do with the subspecialists aren't getting paid through Medicaid like they're supposed to. In any event, radiation oncology, if you want to do that one day, medical students, it's way down there. I'm not sure what other is. I thought they covered everything pretty well here. Even dermatology was pretty high. Radiology was really high. I wonder if that has to do with sitting in a dark room all day or just being, I don't know why they would be so burned out, but they are. So in 2015, this is from the Mayo Clinic, by the way, they repeated the survey, and you can see across the board, every specialty went up. So I said, well, I wonder what's going on recently, and in 2016, this was repeated by Medscape, and you can see pediatricians moved way up the scale. The numbers also went from, in 2011, between 30 and 60% to between 40 and 70% in 14. And now, almost 1 in 2 physicians across the board report burnout. 1 in 2 physicians. In the room, about a little over half of you said you have a good sense of well-being. 1 in 2. I guess it is an epidemic. There's a question then, why? Why are so many doctors burned out? So there was this other survey done. Doctors answered, too many bureaucratic tasks, too many hours at work, not enough money, increasing computerization of practice, and the impact of the Affordable Care Act. Show of hands, anybody disagree? Anybody agree? Yeah, kind of. Anybody disagree? I suspect the younger physicians and the medical students and certainly the pre-medical students are going to come into a paradigm in which there may not be quite as much change, and certainly in which there's going to be an expectation for computerization. But it's been a tough change for those of us who have had to undergo this paradigm change. This guy tweeted, which one of these helps me at work and which one of them slows me down? Two computers, you know, the phrase, the albatross around the neck, all really you would think you would need would be that right there as a stethoscope, but yet he's dragging around all this technology just to be able to do the work that he wants to do. So as I thought about that, I thought about my own pediatrician. I grew up, as I said, in Crowley, and I was born in 1965. That makes me 51 if you're doing the math. And my pediatrician, Dr. Jack Frank, practiced until he was in his late 80s. And he passed away in his mid-90s. And Dr. Frank, I thought to myself, well, how would he answer this question? And that right there, when he retired, I got my chart. That's my medical record from 1965 to 1983. And it's also, by the way, the medical record for me and my two younger brothers. And, you know, this was at a time before I think we made as many diagnoses of oppositional defiant disorder and behavioral disorders and attention deficit disorder. And because I think that if it had been so prevalent as it is now, that the chart in the outside would have said something like that. But so you know, I opened the chart, and that right there is the first page of my chart, and that's my vaccine record. So I'm grateful to my parents that weren't anti-vaccinators. But on this first page, there are 6 office visits on one page. And by the way, back in those days, they used both sides of the page, and so one page might hold 10 or 12 office visits. Today, one office visit takes between 6 and 12 pieces of paper. Now, I'm not suggesting that perhaps this is the way to document our medical records, certainly. But I wonder, it does demonstrate the point that, you know, he spent more time, these are his too, by the way, he spent more time taking care of patients and less time doing paperwork and busy work. You know, the busy work of medicine was really just something to sort of support the practice of medicine, not the other way around. By the way, this is his medical bag that he got when he was in medical school in late 1930s, early 1940s that he gave to me. These are glass syringes that he used in his practice. And that's his microscope. I also have the external light source that reflects onto this mirror so you can see through it. And I'll put these up in my office. If you ever come through, you'll both see them. But yeah, it's a real shift. And I think a lot of that is why it is the shift from taking care of patients to having to do so much work in order to take care of patients is why the level of stress and burnout may be so high. We'll talk some more about that. Annals of Internal Medicine this year did a study in September. They published it in September, and they did a time work survey of physicians in ambulatory practices. And what they found was, for every hour, the doctors provided direct clinical face-to-face time, 2 hours of busy work. They actually followed physicians in the room, how much time was spent talking to a patient, examining a patient, explaining a plan of care, treatment to a patient, and then how much time was spent documenting that, implementing the plan of care, working with case management, getting a referral set up, setting up follow-up, 2 to 1. This painting was done in the late 1800s. Wall Street Journal in 2013 did a series of stories on physician burnout. This painting was done in the late 1800s called The Doctor, and you can see that there was a patient was in the home. The patient is in her bed. The doctor got his attention on the patient. The parents are in the background distraught. They showed this as part of that series in the Wall Street Journal as well. This is a painting from a child out of our experience in the doctor's office, and you can see they're in the clinical setting in the exam room. There's the patient. She's smiling. She must have had her vaccines and isn't worried about polio and other vaccine-preventable diseases. There's a doctor. This is a 2 or 3-year-old child, a small child's rendition of her experience in the office. And there's the family. And of course, everybody's smiling, which is a good thing. I think that speaks to the advances in medicine, that children don't die of horrible diseases like they used to. But what's happened in that the perspective of a child is such that our heads are buried in computers all the time. Everybody in this room one day got a letter or an email that said, "Congratulations. We at the medical school are offering you an interview. Come to medical school. Be here on this day and time." And you were excited, and you called your parents, and you told your loved ones, and you got your best suit on the day and time, your Sunday dress, and you went over to the medical school, and you sat down in a room with somebody, and they asked you a question. Somewhere in the day, they asked you a question. Why do you want to go to medical school? Show of hands. How many people said, "Because I want to be a glorified data entry operator"? Okay, fifth time I've given this talk, nobody's raised their hand. No, everybody said, "I want to," some version of "I want to help people." Right? That's why we went to medical. That's why we do what we do. We want to help people. We want to help even the people who, those who were lying about it in their interview, still at their core somewhere, they were just saying it to try to get it. They still meant it. I do want to help people some sort of way. We did not spend such a large portion of our lives in the study of, the training for, and the practice of medicine to become data entry clerks for the federal government, hospitals, health insurers, and plaintiffs' attorneys. I said that, and I said it today, and I believe it. What are the consequences of burnout? Our patient care suffers. Patients suffer. They didn't come to us to suffer. They came to us to get better. Depression and suicide. I personally know 5 physicians through the course of my career who have taken their own lives. Early retirement and physician shortages. Surgeon General of the United States says we need more physicians, and yet the way we are being forced to practice medicine is leading to early retirement, to decreased number of physicians through retirement, through quitting medicine, and through early death. Well, I'm going to spend the next 10 or 12 minutes talking about what can we do about this. How can we make our lives better so we don't succumb to the pressures of our current practice environment? Refocus. You've got to take some time out of whatever it is, if it's a day or a week or a weekend, take some time and unplug. Turn off the phone and the tablet and the computer and unplug and refocus. Determine in your life what is it that's important to you. And then, once you've done that, reprioritize your lives and simplify. We all have to do this. And we have to do it on a regular basis. Not just once, but we've got to do it every so often. And it's hard. I'm mic'd up. Yesterday I gave the same talk at Children's Hospital. I had 2 mics. Somebody was watching me online, and my phone was buzzing the whole time with the issue we were dealing with the Louisiana Department of Health. It's hard to unplug. We've become a society of people who expect to be plugged into the world. But we need to do this if we're going to walk away, if we're going to take a step back and figure out a way we can practice without getting so tired, stressed, and burned out. I'm going to talk about, so this one AMC says, spending less than 20% of time in a meaningful activity increased burnout by 54%. Think about your own lives. How many of you spend more than 20% in something that's meaningful to you? Whatever that is. Maybe playing golf, maybe you're reading, exercising. We've got to change that. So I'm going to talk about the solution in 3 different areas of our lives: our professional lives, our personal lives, and our financial lives. Well, we've got to increase the amount of time that we spend in those activities that are meaningful by identifying them, prioritizing our lives around them, and then scheduling and protecting the time that we need for those meaningful activities, and then enjoying them so that we can, indeed, have more meaningful lives. All right, so professional. We spend more time with patients. The way we do that is I believe we ought to delegate anything that we are not required to do. Now, I'm not confused, so I don't want you to get confused about that. I'm not required to do patient registration in my office, but I need to know how it works. I'm not necessarily required to call the insurance company and get approval for the referral to the subspecialist, but I need to know how that process works. I don't have to do it. I need to know how to do it. Delegate. That includes engaging patients. So patients can help you with their history. They can enter that data online. They can fill out a registration form that has a medical history. You can go over it and review it and make sure it's included in your medical record, but you don't have to sit there and go over every single question every time. Now, the medical students, that doesn't apply to you. You have to do that for now, but later on you don't have to. That's how you learn how to do it. Use your staff. I've trained medical assistants to be my scribes, which makes it so easy because when I'm in the room examining and talking to a patient, I'm talking to the parents, I'm talking to the patient, I'm examining the patient, I'm talking to the parents, and as I'm talking, just like I'm talking to you right now, I'm letting the scribe know what I want the note to look like. Now, I got to go back and review the note and make sure it's accurate and all of that, and I have to edit it sometimes. But it's worked so well for me for the last 2 or 3 years. It's hand in glove, and I feel better because at the end of the day, I'm not spending 4 hours doing medical records, and the staff feels more engaged, and the patients enjoy it, and overall, for me, it's been a positive thing. Using medical assistants to do any number of jobs in the office, physicians' assistants and nurse practitioners. Now, I mentioned earlier that we oppose the independent practice by nurse practitioners, but I didn't say we shouldn't have nurse practitioners or physicians' assistants. I think they ought to work hand in hand with physicians. Use your front office staff. They are the gateway to your practice. I mean, the people who are smiling and answering the phone and making it easy to get an appointment, those people are as valuable as anybody in your practice. We have to be educated. We don't have to be experts, but we have to be educated and aware of what's going on outside the practice of medicine, but that is influencing the practice of medicine. And I'm not saying you've got to be an expert in every area and every one of these things, but macro, MIPS, ACOs, CPC+, APM, each of these things these are acronyms for something. I know what some of them mean, others I don't, but I know they're all in the news and they're going to be affecting us in 2017 and beyond. And so though we don't need to know about these things, we do have to stay engaged and know, we don't have to be experts, but we have to stay engaged and know what they are so that we can, because they're influencing the way we're practicing medicine, so we can stay ahead of the curve as much as possible. So we can reduce our stress, so we don't experience burnout. And you can do that by using outside sources, state medical societies, LSMS, the AAP I talked about, and consultants. Our physical health. I got out, when I was in medical school and residency, I didn't exercise nearly as much as I wanted to. I didn't eat right. I ate on the run, vending machines, whatever was in the cafeteria. We've got to take care of ourselves. I'm always reminded of the video or the flight attendant telling you that if the plane, the oxygen masks fall down, you're with somebody, put it on yourself first, right, and then take care of the other person. And that goes back to the ABCs of resuscitation, right? If you're not breathing, you don't have an airway and breathing, how can you take care of somebody else? We've got to take care of ourselves. We've got to eat better, find a way, and that slide I showed you earlier about refocusing, reprioritizing, and simplifying. Find a way to eat better. Find a way to exercise. Find a way to rest. Even if you save it all up for unplug and rest. You'll be so happy that you did. It's hard to do. We're all type A personalities. We're all wired up to be high performers and to study hard and to work hard and to study hard and work hard some more. We don't take time to rest. I'm guilty. I'm as guilty of it as anybody. But I know that when I do block off time and I take it easy and I unplug, the next day I feel like, oh my God, this is wonderful, This demonstrates that corporate America has figured this out. Corporate America knows that a tired, exhausted workforce is an unproductive workforce. And they show that in 1991, average American workers took 20 days off a year. And it went up a little bit. In the late 90s, it was 21. Here we are in 2015. So they're forcing people to take vacation because they know that if they don't rest and take it easy, they're not going to be a productive workforce. And neither will you. Me. Our spiritual, emotional, mental health, we got to rest. I keep saying that. Spend time with our family and friends. We have 3 children. I'm my wife and I. We've been married almost 28 years. We got married my senior year in medical school. And we have 3 kids. Our oldest is 25. She's almost 26. She'll be getting married in April. And her roommate from college, and shortly after for a couple of years, 2 or 3 years, is in medical school. She's a third-year student down in New Orleans. And my daughter says, I never hear from my roommate, my old roommate. And we were best friends. And I said, well, honey, she's busy and she's got things going on. And she, no, but I don't hear from her. I'm worried about, And we're guilty of that. We tend to get into our own circle in medicine, and we don't get back to people who are important to us. I firmly believe that we are all sort of wired up. Our DNA is such that we're to be in fellowship with other people. And now, some people more than others. And there's some people you don't want to talk to sometimes. But by and large, there are those folks. We are supposed to be engaged with people. We have to find a way to do that. Your church, your synagogue, your temple, your mosque, develop your own spiritual health, whatever that is. Be engaged in something greater than you, greater than the practice of medicine. Spend a couple of minutes talking about our financial health. My friend Dr. Van Cherry told me 3 or 4 years ago, told me that our medical students, I thought he was lying. I thought, we had a couple of glasses of wine. I thought he was lying to me. He told me that there are medical students coming in who were to residency with $300,000 and $400,000 of student loan debt. I said, he's a liar. I said, there's no way. That's a house. And a show of hands, does that sound that not untrue? That is true. Okay. I gave this talk to a group a few weeks ago, and somebody raised their hand and said, yeah, it's our house in the Hamptons, except we have no house. I don't know that I've ever had a mortgage that high. That's a lot of money. And I get it. You had to get through college and you had to get through medical school. But that right there, I read something that said the number one source of divorce in this country is incompatibility. Number 2 is infidelity, and number 3 are money issues. Having the stress of debt is a lot of stress. Now you pile that on to, I'm trying to learn medicine, I'm trying to be trained, I've got people to whom I have to report, I've got to take care of patients, and oh, by the way, I've got to make enough money to get rid of this debt. So how do you get rid of it? Well, figure out how to manage cash. There's a lot of programs out there, a lot of courses. Go figure it out. Take some time, block off time, figure out how to manage money. You'll be glad you did. Get rid of your debt as soon as you can. And then after you do that, save for a rainy day. My friends, it will rain. You're going to need new tires. The roof's going to leak. The washing machine is going to go out. All 3 of those things happened to the daughter I was talking about in the last year or so. Fortunately, we made her, when she was in college, take the Dave Ramsey Financial Peace University course, and she had money saved. Because if you don't have money saved for those rainy days, how are you going to pay for it? Because it's got to get paid for. More debt. You're going to use a credit card. And what's that going to do to your level of stress? Increase it. You see, this is the state we've gotten into in healthcare, and you can see why so many people get depressed. That's a lot to carry around all day. Save for retirement. One day we all want to retire. One day somebody else might want us to retire. They may get tired of us. Why are you still practicing? Get out of here. We don't want you anymore. Save for that day you want to retire. I read I can give you all this information later if you want it, but at 25 years old, if you start putting $100 a month away in a retirement plan and you don't touch it by the time you're 65, the number with compound interest ends up somewhere in the order between $600,000 and $800,000. And it's simple to do. You can find a way to do it. And earlier I had this slide as wealth, but I think it's a better phrase is financial well-being. What I mean by that is, as pediatricians, none of us are ever going to be filthy rich, I don't think, unless we win the lottery or inherit. But we want to be, I think we should all seek to be in a place financially that we can be generous. And that we can live comfortably, that we can help out when we need to. This notion of generosity, I said earlier that we are wired up in our DNA as such that we're going to be in fellowship with other people. And I think that holds true, too, for being generous. We feel better when we give. I mean, right? Doesn't everybody? Don't you? You're less stressed. If you give something to somebody and they're excited, especially if they're excited about it, you get this just, I don't know, it's an endorphin kick, I suppose. You just feel better. And it helps reduce stress. It helps reduce depression. So if we can be in a position of financial well-being so that we can be generous, it helps achieve, I think, one of our purposes for being here, and certainly reduces the likelihood that we're going to get so stressed out and that we're going to get burned out. The American Academy of Pediatrics has the Friend of Children's Fund. This is an excellent charity. I'm not saying you have to give to it. There are a zillion out there. Find something you like and support it. I will say a word about the Friends of Children, though, that after Hurricane Katrina, Hurricane Rita, the floods in North Louisiana in the spring of this year, and the floods in South Louisiana in late summer of this year, Friends of Children, my inbox, Dr. Bancheri's inbox, Ashley's inbox, filled. My phone started ringing. This is a part of the AAP. It's a fundraising, philanthropic part of the AAP where they give back to anything that needs money when it's dealing with children. But anyway, our inbox filled up and our phones were ringing. How can we help? What do you need? What can we do to help you? Are there children in need? Do they need diapers? Do they need medications? Physicians who are practicing whose offices are closed. How can we help you? They've got a lot of money, and they've got it because of generous people who have supported this over the years. Well, the outcome of well-being, you're going to sleep better, you're going to feel better, you're going to perform better, you're rested, you feel great, you're going to practice better, your health is going to improve, you're going to have better relationships with your friends and your family and your colleagues and your coworkers and just about everybody in your life. I was asked after one of these, what's the Academy doing about this? So I looked into it. Well, the AAP, along with the AMA and a lot of other professional associations, or as I said at the beginning of the talk, are looking into this and what they can offer their members to reduce stress, burnout, and make us better physicians. This was a study done, a report done in, about 2 years ago by Dr. Skip Brown and a couple of colleagues down in Galveston, who were one of the leaders in the Texas chapter, for the Academy. There's a section on integrative medicine and physician health on the Academy's website. The AMA is interested in this. Dr. Barney Dreyer, this year, right before he left office, was the AAP president, said, the board of directors and executive committee are developing a strategic plan for the AAP, and it's going to include a focus on physician wellness and on leadership at every level of careers. Our professional associations are excited about this. Back to the commercial, another reason to be part of it. So I'll wrap up with this. I started my practice in 1993, and there were only 6 pediatricians in Lafayette at the time. Prior to that, there had been about 25. There was an oil bust in the mid-'80s. They all either retired or left, and so I came in, I hung my shingle, opened my practice day one, no managed care, no Medicaid, all cash-paying patients. I saw 40 patients and just got busier and busier after that. Over the course of the next 6 or 7 years, I grew the practice to 6 physicians. I was working all the time. I was never home. My children were growing. And in 2000, 7 years later, it all came crashing down on me. Practice started to break up. Everybody was mad at me. I thought I was working and I was doing the right thing. I was doing what I'd been trained to do. I studied hard. I worked hard. I studied hard. I worked hard. I was working hard. I was studying hard. And in the spring of 2000, I was having a talk with my senior pastor, who was new in our church in Lafayette. We attend Asbury United Methodist Church in Lafayette, and I had an agenda. I always had an agenda. I still do probably sometimes. I walk in with my agenda, and I said, Ed, I've got 3 things I need from you. Number 1, we're going on a mission trip to South America. I need some money from the church to sponsor the mission trip. Number 2, our daughter's getting baptized. The older one's getting engaged. Baptized. We need to schedule that baptism. Number 3, I need to go talk at worship services to recruit people to come on the mission trip. And he said, yes, yes, and yes. He was new to the congregation. He said, tell me about yourself. And as you can tell, I can talk. I can go on for 2 hours. And so for 2 hours, he sat and listened to me. Now I know he had other things to do. But that man sat and listened to me talk and rant for 2 hours about my life and upbringing and what I planned to do and how I was going to do it and whatever. And when I took a breath, he looked at me and he said, God first. I said, I'm sorry, what? And he said, God first. He said, put God first in your life, in everything that you do. And I said, yeah, I'm going to get to that. I've got my practice I'm building. We're going to, my family, blah, blah, I'm going to do this, and I'm doing that. No, he stopped me and he said, just listen, put God first. And then your family second. and then everything else third. Moment to moment, day to day, do this. God first, family second, everything else third. I left his office that day, and I went back about my business and was doing what I was always doing. And about 2 o'clock in the morning, a couple of weeks later, I was at my desk trying to wrap up paperwork and make sense of this practice that was breaking up, that I'd worked so hard to build. And I had a bit of an epiphany. It occurred to me, our daughter, the one getting married, who's in April, was 9 years old. And it occurred to me that her time with me in our house as our family was about half over, right? 18, graduate high school, go to college. And I thought, if I don't change the way I'm doing things, she's going to grow up and leave, and I'm going to still be here at my desk at 2 o'clock in the morning doing this. There's got to be a better way to do it. So I went home, and I woke my wife up at 3 in the morning. Now, as she looks at me, and my wife is from Shreveport. She says a southern accent. My kids and I tell her it's a redneck accent. Take your choice. But I woke her up, and I said, honey, I'm gonna cancel patients today, and I'm gonna take the kids to school. I'm gonna be home all day, and I'm gonna do those things I told you: rest, unplug, and reprioritize and refocus. And she sat up and she turned on the bedside lamp and she looked at me and she said, now, honey, you know I love you, don't you? And I said, I do. And she said, but do I need to get you one of those emergency psychiatric admissions to the hospital? I said, she didn't really say that, but I know she thought it. And I said, no. She goes, no, she said, it doesn't matter because, they'll think you're on vacation. It doesn't matter. We won't tell them where you are. That day started for me a new path, and I'm not here to give you a sermon, but to tell you, there is something greater than us in medicine, and we've got to seek that in our own lives, whatever that is for you. I took my experiences and I wrote a book. I mentioned, this is it, God First, Setting Life's Priorities. It's a small book. You can read it in an hour if you so choose. It got published about a month ago. We've sold over 1,000 copies. We're excited about that, and we haven't really published it too much, or publicized it too much. This worked for me. I can't tell you what's going to work for you specifically. I'll give you some recommendations. But I will tell you this, and I'll close with this. Everybody in this room, including me, are too valuable. We are too valuable to our Creator. We are too valuable to our family and friends. We're too valuable to our patients. We are far too valuable to be burned out, especially as a result of external influences from the federal government, state government, hospitals, health insurance companies, plaintiffs' attorneys. We are far too valuable not to experience a high level of well-being. And that, my friends, is the answer to the question, what does this even mean? Thank you for your time and attention. I'll take any questions you might have.